Well, cases of respiratory viruses are surging across the country. In the last 4 weeks, hospitalizations are skyrocketing for the flu, RSV, and COVID-19. More people are getting sick and not enough are getting vaccinated. That's according to the CDC. So to take a look at why this is happening, we have our friend, epidemiologist at the University of Illinois at Chicago, Dr. Katrine Wallace. Dr. Kat, good to see you this morning.
Good morning. Thanks for having me on.
Thank you. So first, there is a new COVID variant that is unfortunately spreading quickly right now. So what is different? What do we know so far about this one?
Yeah, so we have a lot of people sick right now. A lot of people are getting sick for the first time with COVID, and this is happening because we have a lot of variants circulating right now. And in the mix of that, we have this new one called JN.1, which has increased a lot in the last month from like 8% of cases now to over 50% of cases in the US. So it at this point doesn't seem to be more severe. It just has some mutations that make it more contagious. And of course, with more cases, then we will see more hospitalizations by a matter of the numbers.
Similar symptoms to the other strains of COVID that we've seen?
Correct. That's right. And there's no indication that the vaccines won't work and we know that the home tests are effective. But we are just seeing a lot of cases because there are not a lot of people preventing COVID at this point. We don't see a lot of masking. We have less vaccination going on. So it is a little bit of a concern when we keep getting these new, more contagious variants.
Indeed. Hospitalization rates are also up for RSV and the flu across the country, not just here in Chicago. So RSV being the lead cause for hospitalizations for young children right now. What do you think is contributing to that surge?
So it is unfortunately the time of year when we do see surges in RSV and influenza. RSV is, like you said, it's a very dangerous disease for little children because they have such small airways. It also affects the elderly. For the first time this year, we actually have an RSV vaccine for elderly people, pregnant people, and we have a monoclonal antibody shot for babies. And this was also part of the CDC's warning that these are not being utilized enough. And also influenza, that is up like 200%, the hospitalizations for influenza, and that is really taking off in the data. So it is that time of year, but it is also really important that we protect ourselves with vaccination and other things.
I mean, you said it right there, but the CDC did release a health alert about an urgent need for more people to be up to date on their vaccination. So what is your message to people who are not currently up to date?
Yeah, so we know that the vaccines are really good at preventing severe disease. A lot of people think the vaccines don't work because you can still get a COVID infection after being vaccinated. So I think a lot of people have kind of given up on them. But what we know, the strong point of these vaccines is that they really do protect against severe disease and death. And same with the flu vaccine. That is their job, to protect against severe disease. And we are seeing this national increase right now in hospitalizations for respiratory viruses because we don't have enough people vaccinated for these diseases.
Outside of vaccination, what are some of the other ways that people can protect themselves and their families as we're just in this season of sickness, unfortunately?
Yes, since we're all going into holiday gatherings, my recommendations for that would be just make sure you test before you gather with people. Make sure you know what's going on. It's really easy for everybody to take a test before getting together. Definitely test if you're symptomatic or if you've had a COVID exposure, even if you don't have any symptoms. Also, masks work in crowded, poorly ventilated indoor spaces. I know people are tired of hearing about masking, but in a time when there's a lot of COVID around, it does give you an extra layer of protection. Also, staying up to date on these vaccines, like we said, as the virus changes, the vaccines change, and that's important to keep up to date. And also, most importantly, stay home if you're sick. Do not go to that gathering if you are sick. Even if you do test negative for COVID, you could have something else.
That is probably the best tip right there, because I know a lot of people still show up when they've got a cough or they're sneezing, and it's just don't. COVID has been with us for 4 years now. What do we know about it now that we didn't know before?
We learned that the vaccines are preventing long COVID in children, which is great. There's lots of breakthroughs in terms of medication. We now have an antiviral, Paxlovid. If you do get sick and you're in one of those high-risk categories, you should go get your healthcare provider to give you that. So there have been a lot of breakthroughs, but the basics are the same. We really should be doing a better job at preventing COVID because it isn't going anywhere.
Indeed, it's not. Dr. Katrine Wallace, an epidemiologist, thank you so much for your time this morning, bringing all of this good information, a lot of which I actually didn't know. I didn't realize that the vaccines were helping prevent long COVID in children. That's super interesting.
Yeah, just this week that data came out.
Oh, that's good news. That is good news. Thank you.
Thank you.